So what is a personality disorder? We all have personality traits, things like our degree of openness, conscientiousness, extroversion, and neuroticism. These are relatively stable and consistent patterns of perceiving the world which affect how we think about and relate to the world. Our personality traits are seen in the way we behave, our attitudes and our feelings. For most of us, they are flexible and adaptable enough for us to function normally in a range of situations. However, for some, their personality traits are inflexible and maladaptive. This affects their cognition, affectivity, interpersonal functioning and impulse control, which in turn affects behaviour. And this can be significantly outside cultural expectations. This causes significant distress and impairment across all facets of life. Importantly, it creates interpersonal dysfunction, that is, difficulty in developing and maintaining close, mutually satisfying relationships, understanding other people's perspectives and managing conflict within relationships. This can lead to instability in personal relationships and in employment. The onset of personality disorders occurs in adolescence or early childhood. The DSM-5 identifies 10 personality disorders in 3 clusters. Cluster A includes paranoid, schizoid and schizotypal personality disorders, and individuals within these disorders can appear odd or eccentric. Cluster B includes antisocial, borderline, histrionic and narcissistic personality disorders, and these individuals can appear dramatic, emotional or erratic. Cluster C includes avoidant, dependent and obsessive-compulsive personality disorders. Individuals with these disorders can appear anxious or fearful. Interestingly, the forthcoming ICD-11 is going a different way. It will have a single diagnosis of personality disorder and will introduce specifiers called prominent personality traits, plus will allow the person's disorder to be classified according to severity, mild, moderate or severe, based on the level of dysfunction in their relationships and in everyday life. The diagnosis can be further personalised in a number of ways. This has been done so that treatment is also more personalised. The DSM-5 approach tends to pigeonhole people into one diagnosis with its favoured treatment regimens, though their symptoms often overlap with more than one disorder type. So this approach will encourage clinicians to look at the individual and their particular strengths and dysfunctions in deciding how to treat them.